it means air dryer will cause more infection. So we oppose to use the air freshener, but we propose, okay, we use instead of tissue paper, but as the tissue paper also kept in the toilet, it also get contaminated with the bacteria and viruses, but in less amount. They are telling that if the force is more of air force is more, so more bacteria and virus will germs will attack to your hand. But sometimes in air freshener, or means air dryer, they use the Dettol air freshener also sometimes. So we don't know. Both is equally harmful. Okay, but we have to use it after the we drying for our drying. Our main thing is how we can escape. We use our own towel. Carry your own towel in your pocket, then use that for your hand drying. Don't use the public tissue paper and public air dryer, etc. Use your own towel from your pocket for your washing, drying your hands. So when we are talking about this mode of transmission, you can see the sneezing, coughing, then the infected person, it come to the hand, and all of us know this, handshaking, it contribute to other persons. And then this one will transmit to other and spread the disease. So hand hygiene is very much important. And with this, I just want to share that WHO thing again, because it is transmission WHO guideline, WHO guideline, and in hospital setup, you can see this video also you have seen, the bacteria are there, and from there it is transmitted to other places. You can see when the person getting treatment, the virus and germs touch the medical health workers, and then it comes to the hand of them. The infection rate also calculated. These are all scientific data. It is not that vague. As you can see that I have shown the YouTube, you may think that, okay, it is a very vague thing, but it is not like that. When you wash, we wash only hand, not up to the elbow, then the contamination germs are inside the, what to call here, the above the wrist. So then that one is going to contaminate to patient A to patient B. Transmission of the bacteria and germs inside the health clinic itself. Okay. And you can see this picture, I just inform you that when you see this contamination through this channel of the what you call the saline or the dripping, and also catheter. The person is having catheter, having the channels. So the channel is contaminated. So that channel contaminated means the blood going to contaminate. Blood going to contaminate means septicemia. In terms of medical terms, we call it septicemia. And when septicemia occurs, the blood become contaminated, the person chance of living is very less. When we touch the oxygen incubators, the oxygen and the Riles tube, etc. is there. Riles tube is not there when dripping is there, but when contamination is there, means respiratory distress, then is an oxygen tube. That tube is contaminated means the respiratory system, lung is contaminated. And urinary tract infection occurs when the catheter is contaminated. Whole urinary bladder is contaminated, going to contaminate inside our body. So very dangerous thing. And doctors and nurses are taking proper trained, and they are trained during their training, but still the infection occur when the bacteria and virus is more dreadful. Means it is not that contamination is same for a TB bacteria and other Escherichia coli bacteria. So there is a difference, and that difference is having inside our bacterial immunity power, grow immunity power, and spreading of this bacteria. So when you please go through this handbook, you can learn if you want. And with this, I am showing this some more things, like there is a electronic boom. So electronic device, when they are wearing gloves. That I want to say, show you that mask and gloves they are wearing. But you see these gloves, if he don't take out before taking food, then what is the use of using gloves? In Malaysia, we are using distance. We are not checking the thermometer. Previously, the thermometer we are using for our temperature check under the inside the cloaca, inside our arm or inside our mouth. We're not using the thermometer no more like that way. In our old days, in our childhood also, we used to use that type of mercury thermometer. Now digital thermometer from a distance, like revolver, the security persons checking the temperature. If he not checking with this thermometer, he use the revolver, shot dead. So now you think 1665, there is a great pandemic in London. 1817, there is a first cholera pandemic. Why I am showing this? Because this is not a pandemic situation, and how we controlling this? All of us know that British persons, UK persons using spoon and fork. They wearing boots, booted. In India, we don't use this fork. In Asian countries especially. European countries all use spoon and fork. We don't use. Chinese people also using stick during eating rice. Soup bowl, they use the soup spoon. But we Indians use our own hand. We like to eat by our own hands. But why the British people, UK people, European people using fork and spoon? This is the reply. Because the first plague in 1665 occurs in London. And that time, the religious thing implemented, yes, that in the church they told, yes, don't use the fork without fork, because it will contaminate your, means the, what do you call it, the Saturn will come in your body if you don't take with the fork. Means fork, use fork or spoon. Like that they implemented by religious way, and also scientific way, that use spoon and fork, because UK etc. in European countries water is very less. Not it is a river oriented country like India. Always water is everywhere. We in our normal places. So we cannot wash hand. So use spoon during food. Even if you are wearing gloves, even if you are not wearing gloves, use spoon. So there is a less chance of hand contamination during the food eating. You can see the stick using for the kebab or taking the salads, etc. Don't use hand to take the food. Convert, change the research. Why you do the search? You change your habit. Take spoon, take fork, take. It is not a what you call the etiquette or a proud privilege for the UK persons is taking by spoon only. Everybody have to take by spoon. It is the new normal. We cannot touch our for taking temperature. We have to make far away. Now every shopping mall, every entrance, airport, we are checking temperature very far. Nobody is going your clothes and checking temperature. From computer, it is recorded. This person, this person, this. Very simple. When we are entering any places, we are taking the QR code scan. Like this ITM Universe brochure, you have QR code. Why? Because you don't have to touch. You just scan and go in. You don't have to touch for opening gate. You don't have to, the China also implemented this for purchasing bus ticket. In IIT also, in Delhi, in IIT, I think which IIT I forget, but India IIT also developed some software for QR code for purchasing ticket in the bus, but it will take time to implement because all buses need to have this type of machines, and also the ticketing software to make